Hi, this is Dee, and this is a quick educational tool for auditory learners for different types of resources, actually two resources in the Houston-Harris County area for cervical cancer screenings. And so the first I am introducing to you is the Good Neighbor Healthcare Center. Um, there is a Heights location and also a Cy-Fair location. This is a clinic that I've used in the past for people that need access to affordable health care, um, and uh, and they are very accommodating to all families, regardless of citizenship status. These are the different types of services that they offer, which for today we will focus on OBGYN since we're focusing on cervical cancer screening. Um, and there is, if you scroll down, you can request an appointment online. You can also go do a walk-in. You may want to request online. I have at times also taken people as walk-ins, and they have been able to be seen. And these services are good for prenatal checkups, postpartum family planning, contraceptive care, annual women's exams, and ultrasound. And so your cervical cancer screening will be in the annual women's exam um, visit. And the here is the patient registration form, and it is in Spanish and English. And we can go through that so you can see uh, what that will require. Their location is 190 Heights Boulevard, 77007. The phone number here is 713-529-3597. They are open Monday through Friday from 8 to 5. And the Cy-Fair location was just opened this year. And they're open Mondays and Wednesdays 7 to 7, Tuesday, Thursday, Fridays from 8 to 5. They do accept Medicaid, Medicare, CHIP, and private insurances. You may bring your insurance card on your appointment, but there's also a sliding fee discount available. And so to determine eligibility, they will ask you some personal questions, and they will to determine these fees and also level of income. These are the different types of identification that you can bring, which is driver's license, state ID, student ID, passport with a picture, ID issued by a foreign consulate. Also, you can also will need to provide them a utility bill or a rental verification form within the last 60 days for residency purposes. And also one of these following documents for each member of the family, which is a birth certificate, a school document, insurance documents, proof of school enrollment for students age 18 to 23. And then here are the income documents for the last 30 days. So it could be one of the following. It doesn't have to be all of it. So 4 paycheck stubs, a wage verification letter from your employer, child support statements, supporter statements, Social Security payment, unemployment letter, or a bank statement. And this page is also printable. And that's what you would need for a Good Neighbor Healthcare Center. Now we'll move on to Legacy. And so Legacy here also has a Spanish option. There are different locations available, and you can see that there are various locations. Again, we're going to be focusing on the OB/GYN and maternity page. And again, we're focusing on cervical cancer. And for cervical cancer, this would fall under routine annual examinations for pap smears, human papillomavirus, HPV testing, and pelvic and other exams. They also offer these other services that you see here. The OBG and maternity services are only offered at the following locations, which is Montrose, Southwest, Maple Ridge, Lyon, Santa Clara, San Jacinto, and South Park. And we will see about setting up a visit, which would be forms. So for new patients, if you're a new patient, we need to complete the following form: new adult patient form, adult medical history form, child. So we'll go to eligibility, patient contract, okay. Okay, so we'll go to eligibility form for the Montrose location. And we'll, okay. And again, they're asking for one of the following. It doesn't have to be all. State-issued driver's license, a USCIS document for an ID or passport or school ID. And then they're also asking for income. They will need a check stub for the current month. If paid weekly, the last 4 pay stubs. If paid biweekly, the last 2 pay stubs. And if paid monthly, the last 3 pay stubs. Or your current tax return. An unemployment benefits letter, a wage detail from workforce. I'm wondering if that's supposed to be WorkSource. Assistance statement verification. Again, the supporter letter, retirement or Social Security benefits letter, or child support payment letter. Proof you are the parent or legal guardian of the child. Birth certificate for each child, legal guardianship papers, Social Security card, adoption papers, any applicable court documents or tax return. Proof of address, a current lease, mail postmark within the last 30 days, assisted statement verification, utility phone, cable, or credit card bill. Proof of marital status, copy of marriage license, copy of joint tax return, or NA for common law. Please notify your staff if you are pregnant and or have a chronic medical condition, as we may assist you in applying for state-funded programs. And there's a number that you can call to schedule an appointment. Or if you also have any questions, that number is 832-548-5223. There's also an email. And then there's also the new patient form. And here is basic information: patient's name, maiden, today's date, date of birth, driver's license, address, city, zip, county, birth date, social security number, main, other phone number, email address. It doesn't say that you have to have the social security number, so I'm wondering if that's optional. Preferred method of contact. Okay, by phone, marital status, gender, what is your current gender identity, sexual orientation, preferred language, race, ethnicity, occupation, homeless, agricultural worker, family size, total family household income, emergency contact, primary caregiver, primary legal guardian, power of attorney if applicable, other healthcare providers, pharmacy information. The insurance question below. Do you or anyone in your household have Medicaid, Medicare CHIP, and or insurance coverage? Yes or no? Have you applied within the last 30 days? What type of insurance do you have? Insurance policy information. Insurance employer information. How did you learn about our services? Okay. Procedures, not limited to. Okay. I'm looking for Social Security number, if that is, you have to have that, although I don't think you do. Um, yeah, I'm not seeing that. I'm not seeing that. On eligibility. Okay, yeah, I don't think you have to have a social security number simply because if one of the following forms of ID is a passport with a picture, then the social security number may not apply, especially if it's an ID issued by a foreign consulate, so that may not apply. So I would fill out the application anyway and ask for an appointment. Again, you may want to print out this eligibility information, and also the new adult patient form, and you can call the number below. Where do we see that number? Oh, that was for the good neighbor, but for legacy. Okay, this is for legacy. So for legacy, you can call this number. Or email if you have any questions, print out those forms, and then take the following documentation with you, which was the proof of address identification, and household income. And so that was my tutorial on navigating these two resources for cervical cancer screening. I hope this was helpful.